Good afternoon. We'll now start. It's already 2 o'clock. So first of all, I'd like to welcome everybody. Please mute yourself, but always show your video picture. Sign in your name, Facebook account, or email address in the chat box. Please include the names of your companions attending. Use the chat box to ask questions and make comments while the pep talk is on. There'll be group picture taking at the start and end of the pep talk. As a reminder, please take the online learning cum evaluation test exercise for mastery of learning and have a perfect score to get a certificate. The link has been placed in the chat box already. This is a sample of the certificate that one will receive after passing the OLETE. Another reminder, 50 OLETE certificates will entitle one to one voucher for ROJoson telemedical consultation. A request is that those who are not planning to take the OLETE, where I usually ask for a feedback to my pep talk, please type in your feedback in the chat box during the open forum and before we part ways or we end our session. Thank you. Let's now have a group picture taking. Okay, please turn on your video and show your face. Please show your face. Okay na? The others will not be showing their face. Okay. 1, 2, 3. How about 1, 2, 3. I have a patient empowerment program in which I like to empower the lay people or patients to take control in the management of their health. There are 3 courses in the pep talk. I completed the core course on October 9 last year, 2021. From October 23, 2021 onwards, I've been tackling health disorder and health issue courses. This may take 3 years or longer. My pep talk today is entitled Low Value Medical Care, specifically on unnecessary operations and surgeries. This is part of the health issue course. The empowerment objective is for the lay people to have an understanding of the importance of low-value medical care, specifically unnecessary operations and surgeries in the management of their health. The contents of this pep talk will be the following. I'll give an introduction again on what is low-value medical care, different types, causes, how common, and then I will zero in on low-value operation, examples of low-value and unnecessary operations, what are the causes, types, and side effects, and what are my tips in avoiding or reducing low-value or unnecessary operations or surgeries. First topic will be what is low-value medical care. Low-value medical care is defined as medical care or a medical service that provides little or no benefit to the patients, have potential to cause harm, incur unnecessary costs to the patients, or waste limited healthcare resources. So the first part of the definition will be it provides no or little benefit. And this is in terms of effectiveness of whatever care that is given. So it's not effective in the goal, in the objective of the medical services rendered. The second element is it has the potential to cause harm. Okay. There's a risk for unwanted side effects or adverse effect, complications, and sometimes even death with the medical services rendered. This not only include the physical harm, but also the psychological side effects. Unnecessary cost to the patients, the third element in the definition of low-value medical care, is in terms of money spent by patients and families for the medical services rendered, which is considered, in the end, unnecessary. The fourth element here will be waste limited healthcare resources. This is in terms of unnecessary usage of finite, meaning there's a limit to the government funding or budget for health of the citizens, like the PhilHealth, and unnecessary usage of finite number of services like hospital beds, tests, and procedures. So remember these four elements. Okay. Now, low-value medical care can be equated also as unnecessary, okay, or not needed medical care. It can also be equated to those not indicated, it's not supposed to be done, and not in the patient's best interest when weighed against the other available options, including watchful waiting and other more conservative measures. If there is such thing as low-value medical care, there's such a thing also as high-value medical care. So high-value medical care is providing the best medical care possible, efficiently using the resources, and achieving optimal results for its patients. What are the different types of low-value medical care? So basically, we classify them into three: unnecessary medications, unnecessary diagnostic tests, and unnecessary operations or surgeries. When you say unnecessary prescription of medications, okay, so these are the prescriptions that provide little or no benefit to the patients, may be harmful, incur unnecessary costs, and waste healthcare resources. Okay, the four elements of low-value medical care. Examples of low-value prescription will be prescribing antibiotics for viral upper respiratory tract infection, which is not indicated. Prescribing antibiotics for asymptomatic bacteriuria. Bacteriuria means bacteria seen in the urine, but the patient is not has no symptoms. Then prescribing a lot of antibiotics and supplements when they are not indicated. Another type of low-value medical care is the unnecessary diagnostic tests. This is ordering of tests that provide little or no benefit to the patients, may be harmful, incur unnecessary costs, and waste healthcare resources. So examples will be ordering pre-operative tests for clearance. Okay. So practically a lot of patients, before they undergo operations, they have a routine so-called cardiopulmonary clearance, and this has been shown not to be necessary, especially for those who are to undergo the so-called low-risk surgery. Low-risk surgeries means you don't expect a lot of complications, or it's not a complicated surgery. Then another example is ordering MRI for non-specific low back pain. Okay, with the popularity of MRI, everybody is jumping on MRI for the non-specific low back pain, which is not necessary also. The last type of low-value medical care is the unnecessary operations and surgeries. So these are the performance of the operations that provide little or no benefit to the patients, may be harmful, incur unnecessary costs, and waste healthcare resources. So examples of low-value or unnecessary operations would be circumcision, cholecystectomy for asymptomatic gallbladder stones, and cholecystectomy for asymptomatic gallbladder polyps. So what are the causes of the low-value medical care in general for the three types? Okay. So one, there are three factors. The primary factor is the physician-driven factor. Then you have the patient consumer driven factor, and the third factor is the health system factor. The physicians are the primary factor because of their greater influence in promoting or avoiding low-value medical care, because they call the shots. They usually are the people who the patients look up to, and the patients usually just follow them. The secondary factor will be the patients because of their mindsets and desires, which the patients want to satisfy above anything else, and which can lead to a low-value medical care. So examples of physician-driven factors, these are specific items under physician-driven factors. Number one is the mindset in the medical management of the physician or doctor. There's such a thing, types of physicians which are called ritualistic and maximalist physician, which I'm going to explain later on. And the other factor will be financial gain, whether incentivized or non-incentivized. Non-incentivized means personal, okay, because of a more business than compassion sense. Then the third factor would be the wish to just please the patient, okay, their mindsets and desires. Okay. And then the other one is the fear of malpractice suits if something went wrong. Then the last one is no clear presentation and discussion of the options of management. As I said, there are three types of physicians, okay, based on their approach to medical problem solving, okay, decision making, and recommendations. Okay. These are the so-called mindsets of the doctors. So you have ritualist physicians, maximalist, and minimalist physicians. Ritualist physicians are those who make medical management decisions just based on habits, okay, and not mainly on critical analysis. Okay. So yung mga natuto nila, they just follow, okay, what is being done by their colleagues before or by consultants. They just follow without thinking, without doing an analysis of the indications. So ritualist physicians usually lead to low-value medical care. Maximalists are those physicians who institute medical management that includes a lot of things that are not essential. Yung mga nice to have, okay? So this can also lead to low-value medical care. Minimalist physicians are those who just institute management, which includes only those which are essential and really needed, really necessary by a patient. So this leads to high-value medical care. The other physician-driven factor, as I said, is financial gain. This could be incentivized, okay, or not. Example of incentivized financial gains would be those institutions which give rewards, no, to doctors who would prescribe a lot of medicine, this and that medicine, prescribe this and that diagnostic test, and do this or that operations. Okay, so they're being rewarded with stock dividends, example, perks, and then free trip abroad, etc. The so-called non-incentivized one will be, it's on a personal basis. Okay. Example, doctors would have, if they have their own pharmacy, okay, so they'll prescribe medicine which can promote their business. If they have diagnostic business, also diagnostic test businesses, no, they'll also left and right just order the diagnostic test. Okay. Ways to please patients or consumers, their mindsets. Okay. So pleasing patients on their mindsets and desires rather than explaining and educating and convincing the patients on the rationale for the care. Fear of malpractice suit if undue development occurs when they do not accede to the unfounded mindsets and desires of the patients and the relatives. So related yung pleasing the patient and the fear of malpractice suits. Okay. The last one is, which is the most very, very important, is no clear presentation and discussion of the options. Okay. In terms of BRCA, benefit, risk, cost, availability. Okay. These are the parameters that you use to compare the different options. So there's no clear presentation and discussion of this based on the BRCA. So when you say high-value medical care, we look not only for the how effective is the option, a particular option, but we look at the cost. Okay, so the priority is to look for the most cost-effective option, not just effective options. So, example of a BRCA is a table that will be that looks like this. So, first column you have the options 1, 2, 3. Then the second column, the benefits. So all the benefits for each option should be explained or written down. Okay, the risk also, third column. Okay, the risk for each option, the cost for each option, and then availability, whether they are available, readily available, and not readily available. So the second factor for the causes will be the mindset and desires of the patients. Again, there are three types: ritualistic, maximalist, and minimalist patients, as there are ritualist, maximalist, minimalist physicians. Pareho lang, okay? So ritualist physicians are those who make medical management decisions because patients are sometimes usually asked what they want, okay? So they base their decision based on habits, fads, yung mga trends, okay, biases, okay, not mainly on critical analysis. Again, this will lead to low-value medical care. Maximalists, those who want treatment, yung mga nice to have, no, but are not really essential. Okay, so this will lead to low-value medical care. Minimalist physicians will be those who just want the most, will tell the doctor, I just want to have the most essential and what is really necessary, okay, for my management. So this will lead to high-value medical care. How common are the low-value medical care? Very common abroad. Okay, I suppose it's very common in the Philippines. Okay, and to trace back, it has been done present since time immemorial. Okay, even before Christ and Genesis. Okay, now there's a formal movement, okay, advocating high value and reducing low value medical care. Okay, this was instituted because usually the government funding is now being challenged. Okay, now that we also have the so-called universal health care, okay, it has been passed now, so the government will now start looking at these things also eventually. Okay, I hope. Okay. There was a popular movement called the Choose Wisely USA, starting from USA, okay, in 2012. Okay. The mission is to promote conversations between clinicians and patients by helping patients choose care that is, one, that is supported by evidence. Okay. Number two, it's not always repeated or duplicated. Okay. And then, because these things often happen. Okay. Doctors repeating a lot of tests, okay, even though not needed, free from harm, and truly necessary. Okay, note the word truly necessary. Okay. Now, this movement has been spreading globally across Europe and Asia to over 20 countries around the world nowadays. It can be more, okay, because of the the big expense that the government has to support the health of their citizenry. Okay. Nowadays, there is a formal tracking. If you look at the internet, there's a formal tracking of low-value medical care in hospitals. They list down all the hospitals which are practicing low-value medical care and those who are practicing high-value medical care. There's none yet in the Philippines, but I hope in the future we will have that coming. As I said, it's very common because in practically all prescriptions, ordering of diagnostic tests, and performance of operations, there's always a potential or risk for low value because of the three factors: physician, patient, and health system-driven factors. Okay. And more so, it has not been practiced by most physicians to present and discuss the BRCA data and processes with patients. They just recommend this. That's all, okay, without giving them the options and then without explaining, comparing the different advantages and disadvantages of the options. Now, let's focus for today, which focus on the unnecessary operations and surgery. Okay, I have discussed unnecessary prescription, unnecessary diagnostic tests in the previous weeks. So what is low value or unnecessary operations or surgeries? So it's a performance of operations that provide little or no benefit to the patient. That's number one. Number two, may be harmful. Number three, incur unnecessary costs. And then lastly, waste healthcare resources. How common? Among the three, these are very common, but I just compare the three types. Okay, prescription of medication probably is the most frequent. Okay, then ordering of tests, second most frequent. Okay, or sometimes I don't have the exact data. Sometimes the ordering of tests might be more frequent than prescription. Okay, and then low value operations is the third most frequent. What are the causes of low-value operations? Okay. This is for the operations. Earlier, I discussed the causes for low-value medical care for all types. Now we are now zeroing in on operations. Okay. So three factors again: physician-driven factors, patient-consumer-driven factors, and health system factors. Okay. Again, the usual the set of physician-driven factors: mindset, financial gain, wish to please the patient, fear of malpractice suit, no clear presentation, discussion of options of management. Then for the mindset and desires of the patient under patient-driven factors. And the last one is health system factors, in which there is facilitating, allowing, nobody's policing, no quality control of the practices of the doctors, of the physicians. And then there's also inadequate public health education, patient-centered care management program, or patient empowerment program. Okay. So these are the factors under health system. What are the types of low-value operations? Number one is when surgeries are done and they are not needed. When you say they are not needed, in the sense that watchful waiting, just observation, and sometimes medication will do without the need for the operation. So if these are possible and the operations are done, then it's not needed. Okay. Then the other category would be it's not proven to be effective. Then number three, inappropriate to use in consideration of other options. There might be two types or three types of operations, but what was used was not the better one. Okay. Then operation that is done that is considered unsafe to the patients. And then an operation that is done that is costlier than other equivalently effective operations. So it's not cost effective. So these are the reasons, which are the types of the low value operations. Okay. What are the side effects of low value operations? We all know that operations have side effects, and this can be classified under expected and potential. Okay. So under expected, okay, so when you do an operation, there's an expected side effect. The first one is pain. Pain. Okay. There is pain if there is an incision or a cut on the skin. Okay. There's no such thing as painless circumcision. There's no such thing as painless operation. There's always the pain. Okay. During the cut, okay, before giving if the anesthesia is given, no, baka yung pain hindi maramdaman, but after the operation, there is pain. Okay. Then the discomfort, they just call it discomfort if the procedure does not entail a cut on the skin. If you have a cut on the skin, usually there's a pain. So if you don't pass through the skin, just do, let's say, endoscopy, you will have some discomfort. Okay. So these are the initial unavoidable side effects. Hindi natin may iwasan yon. Okay. Then the second expected side effects are those resulting from manipulation of deeper or internal tissues and organs. Okay. So sometimes we have to go inside deeper to the skin and then manipulate the organs and tissues inside. So you can have pain, discomfort, numbness because sometimes you cut through nerves, yung mga sensory nerves, okay, etc. Now, the third expected side effects is seen in patients in which there's removal of some organs. If there's a need to remove an organ, then there's no choice but no ligtas, you will have the third expected side effects, such as lack of essential hormones needing replacement. Example, you do a total removal of the thyroid or total thyroidectomy, then you need to replace the thyroid hormones. Okay, so and then impaired functioning of some parts. If you amputate something, okay, then you need to have rehabilitation thereafter. Okay. After the expected side effects, now I presented 3 expected side effects. Okay. So the surgeon will now try to control the so-called potential side effects, okay, that or possible complications of the operations. Okay, although the surgeons will try to avoid it, but they cannot guarantee that it won't occur. Okay, so bleeding, example will be bleeding, infection, anastomotic leak. When you say anastomotic leak, there's a attached a suturing of 2 ends of a bowel now, and then there is leak in that anastomosis. Then dehiscence means the wound disrupted, and even death. Sometimes that can occur during the operations. Okay, as I said, the surgeons will try their best to avoid these potential side effects, but no surgeons will guarantee against their occurrence. So these are examples of potential. The other first 3 that I presented were the expected. So that's all the operations and surgeries have side effects, both expected and potential. So if there is no need for an operation, don't go for it. Don't go through it. So don't go for the low value operations. However, if there's really a need for an operation, go for it. Okay, go through it. So this time, go for the high value operations. So to repeat the potential side effects of low value operations, you have unnecessary physical harm, okay, psychological harm, and then also the poor quality, which include the poor quality of life that you may have thereafter, then unnecessary costs and unnecessary waste of limited healthcare resources. So what are examples of low value unnecessary operations? I will just mention a few examples because, as I said, it's very common. Okay. So in the Choose Wisely movement website, you will going to see a list of all these things. There are many. Okay. So examples will be, I got this from the website of Choose Wisely. Okay. Avoid routine cholecystectomy for patients with asymptomatic cholelithiasis. That's rampantly being done, okay, everywhere, okay. Don't routinely surgically excise a biopsy-proven fibroadenoma that are smaller than 2 centimeters in size. So ibig sabihin, if the fibroadenoma is 2 centimeters smaller than 2 centimeters size, you don't have to remove it. You just observe it, okay. Don't routinely operate for a breast abscess, yung may menana, without an initial attempt to percutaneously aspirate or drain it. Wala nang hiwa, wala nang malaking hiwa, just aspirate it with a needle. Or, lagyan mo ng konting hiwa, then palabas yung menana. Okay? So, the other example will be, don't routinely perform a double mastectomy in patients who have a single breast with cancer. Okay? There are a lot of people now asking whether I should have double mastectomy or prophylactic mastectomy on the other side. So it all depends, okay? So rarely is it indicated. That's why don't routinely. The word is routinely. Don't perform surgery for plantar fasciitis, yung mga masasakit sa paa, before trying for at least 6 months of non-operative care. Okay, may maraming surgeons na nag-opera dyan, no? Okay, without trying out for yung mga rehab or some exercises. Okay. Then the last one is do not perform routine oophorectomy, yung removal of the ovary in premenopausal, yung hindi pa menopausal na women undergoing hysterectomy for non-malignant indications and who are at risk for ovarian cancer. Low risk for ovarian cancer. As I said, I just give a few examples. Okay. So now, last topic will be what are the tips in avoiding or reducing low value or the unnecessary operations. Okay. There are three factors, as I mentioned: physician-driven, patient-driven, and health system factors. Okay. So the question is, what can you do as a lay person to help in this avoidance? Okay. The doctors are doing something because of the Choose Wisely movement, but it started in 2012. Okay, but up to now, I don't know how long it will take and how successful it will be. Okay, so the question is, can you as patient do something about it? Okay, so I guess you can. So the best strategy would be to be empowered as a patient, then try to do your part to advocate patient empowerment. Okay, so essentially this is what we're trying to achieve in the patient empowerment program. Okay, that we have been conducting since last year. So be always in touch with the reliable medical information on low value, which is also called unnecessary, and high value, highly recommended medical care. Okay, be in touch with those information. Okay, knowledge is power. Use the 4 Ks of patient empowerment: kaalaman, kakayanan, karapatan, and kapangyarihan to gain greater control over decisions in the medical management of oneself in promoting high-value medical care and avoiding low-value medical care. So specific strategies that I would recommend. Number 1, be constantly aware and vigilant against the potential for low-value performance of operations by physicians and surgeons. Always aim and insist for a high-value operations from them. Be proactive in controlling and avoiding low-value operations. Make the physicians aware that you know the processes on how to reduce low value and how to promote high-value operations. Then after that, have a shared collaboration with the physician in accomplishing this. Before accepting the recommendation for an operation, okay, if the surgeon will tell you, you have to be operated, okay, then you ask the surgeon, what is your specific pre-treatment diagnosis with quantification of degree of certainty or probability? Number 2, what is the goal of the operation that will be done? Number 3, what are the options for treatment? Is it possible to have watchful waiting and more conservative measures like medications as options? Then number 4, is watchful waiting a good option for treatment? So what are the chances that the medical conditions will spontaneously disappear without treatment or without operation? If more than 50% chance, then watchful waiting is a good option. Okay, but you have to get this data from the doctors. Then is a more conservative measure like medication a good option for treatment? So what are the chances? Kanina, first, the other question is it will spontaneously disappear. Now this question is what are the chances that the medical condition will resolve with medication without operation? Gamot lang kung pwede. Okay? So if more than 50%, the more conservative measure is a good option. What are the comparative data and information on the various options in terms of benefit, risk, cost, availability? Okay, so ask the doctor all the data on this, and then ask him what is your recommendation on the cost-effective option. So always, although doctors will not present the data in this form, but at least you know what to ask. Okay, so but the option should include watchful waiting, not just all operations. It should include watchful waiting and more conservative measures as possible options. And then when the physician asks for your response to his recommendations, he should, okay, but a lot of doctors do not do that, okay? So feel free to ask as many questions that you may have on the data and information presented, and also ask him to temper or validate your personal biases, because you might have some personal mindset thinking that you want some wishes on your own. Okay, so ask the doctor, is this correct? Is it correct to say that I should do this, do that? Okay, okay. So ask him to temper your biases in favor for a more objective decision making. And the other one is you are free and have a right to seek a second opinion if you want. Okay. If you're not satisfied with the first surgeon, then you go to another surgeon. Okay. However, when you go for a second opinion, you have to follow the same processes. If you don't follow the same processes, you end up wasting your time, or sometimes you get into deeper, more trouble. Okay, more complications, more confusions. Okay. So some more recommendations. As, as I said, some doctors will have ulterior motives behind the recommendations. Okay. And it's difficult for you patients to know whether these are present or not. Okay. So the best strategy, diplomatic one, is just to ask the physicians, please present and discuss the comparative data and information on the various options in terms of benefit, risk, cost, availability. Okay. Then try to listen and analyze them and make a judgment. Number one, as the physician explains, check his competency on giving you the data, and then try to observe if there are some ulterior motives going on. Okay. So that's the best diplomatic strategy. So the best doctor will have a attitude like this. Sabihin ng doctor, okay, so this is in terms of kung minsan may mga pasyente gusto nila, I want this, this is what I want. Okay, so sabihin ng doctor, I'm not going to prescribe a low-value operation just because the patient has requested it. I just think there's a need for us to talk. Okay, but when I feel strongly about that something has more harm than good, okay, based on the desires of the patient, then I'm less likely to take the patient preference. So I will educate the patient. Okay. And then another statement that a physician can say, I'm sorry, your perceptions on a particular option of treatment are myths. Hindi totoo, incorrect, unfounded. I have to correct you through these explanations. Then he explained, I'm sorry, we have to decide on what type of treatment options to take based on hard evidences, scientific evidences, and not just based on mga trends, mga fad, and popular practices. So my personal practice, I use this BRCA to advise and to make recommendations as objectively as possible, and honestly and compassionately. I respect patients' desire, but I enlighten them if they have misconceptions. So I've presented some the major tips in avoiding or reducing low-value and unnecessary operations. Okay. So let me have a summary and for the takeaway. So I presented all these topics. I will not read them anymore. Okay. And then to repeat, the takeaway in relation to patient empowerment, be always in touch with reliable medical information on low value and high value medical care. Knowledge is power. It gives power. Use the 4 Ks of patient empowerment: kaalaman, kakayanan, karapatan, and kapangyarihan to gain greater control over decisions in the medical management of oneself, yourself, in promoting high-value medical care and in avoiding low-value medical care. So with that, I end my pep talk. I hope I have empowered you to have an understanding of the importance of low-value medical care, specifically on this particular topic, unnecessary operations and surgeries in the management of your health. Before we go to the open forum, please, as a reminder, please take the Olete. The link is in the chat box. And then this is, I think, the 54th Olete pep talk already. So you already have a chance to get 50 Olete certificates. If you have 50 Olete certificates already, you're entitled to 1 voucher. Okay. So again, as a request, those who are not planning to take the Olete, I'm not forcing you, okay? So, because there I usually ask for your feedback to my pep talk and I document them, okay? So, for those who are not taking it, please type in your feedback in the chat box, okay? But I can include it in my report. Thank you. Okay. So let's now have a group picture taking before we go to the open forum. Show your face, everybody. Para maganda na yung group picture natin. Some more? Wala. Baka tulog na iba. Okay. So, okay. We cannot wait for them. 1, 2, 3. Okay. Okay. The floor is now open for questions, comments, sharing of experience.
Doc, good afternoon.
Okay, Susan. Okay, Susan.
Yes, Doc. Wow, one of your patients 5 years ago,
Okay.
and
Nice to see
I
you.
had a very good experience with you. Anyway, Doc, my question is that this is personal. I was found to have a sebaceous cyst.
Yeah.
Ano yun? Ang option daw is either I have it removed or I don't know, basta just I have it removed or what? Wait for it to burst or something? Parang pigsaraw yun eh. So I'm taking my time. Is it bad for me to take my time before deciding?
Okay. Okay, number one, okay, you have your diagnosis of sebaceous cyst, or the other term is epidermal cyst. Okay,
Yes, yes.
epidermal cyst. Now, question is, okay, I suppose it's the correct diagnosis. Okay, kamisan baka incorrect, no? Okay, so just by looking, a lot 99% of the time you can recognize is epidermal cyst. There's a mata, di ba?
Yes, yes.
There's a so-called punctum or mata over the
Yes, Doc.
sa bukol. Okay. Number two, okay. So kung may punctum, 99.9% tama siya, epidermal cyst or sebaceous cyst. Okay. So the question is, what should be the treatment now? Okay. So diagnose, palaging start with the diagnosis and then what's the treatment. No? So in general muna, and then after that, as I said, in general, we have to talk about generalities, and then we go to the specific circumstances in a particular patient. Okay. Example, where is it located? How big? No, ganon. No? Okay. So, but in general, when you say epidermal cyst, it's a benign. Okay. It's not cancer. Okay. So sometimes it can go away. No. Okay. Sometimes, most of the time, it does not once it's formed. Okay, but it's not something serious that you have to hurry to have it removed. Okay, and then in terms of options, no, one, you can leave it alone, just watch it, di ba? Pag maliit lang, just watch it, no? Kasi kung baka 1 millimeter lang, 2 millimeters lang, it's not worth it putting a cut for 1 centimeter, mas malaki pa yung hiwa, di ba? Okay.
Yes.
Okay. So, sometimes it will just, kung maliit lang, it might just, the option is just, what do you call that? Pwedeng pigain na lang because may mata eh, di ba? May mata siya.
Yes.
So sometimes you just piga and then palabasin mo lang yung laman, no? Yung ano, if it's possible, okay, that's one option. So the other option is to remove it, no? If it's malaki na, number two, it's something that has been that has gotten infected before, no? It baka mag-infect ulit, then you remove it, no?
Yes.
So it all depends na. As I just gave you the generalities. So now for a specific decision making, problem solving, it all depends. Nasaan ba yung sebaceous cyst mo?
Under my left breast.
Under your left breast. How big?
Teka.
Parang
Hindi ako
mga 1 10 centavo coin?
Yeah, parang ganon.
Okay. So, maliit lang. Okay? So, nakaumbok.
Yung ano, yung gitna.
Oo, nakaumbok. Di ba?
Yes,
Okay.
yes.
Mapipiga mo.
Yeah, but I'm afraid I cannot do that. Pwede bang hot water na lang?
Hindi siya lalabas kasi may balot siya eh. May balot siya eh. No?
Yes, Doc. Oh.
Okay. Sandali
Hindi ko alam kung nung cause. Nakakainis eh. I'm so OC pa naman and then all of a sudden this happened.
Remember, we cannot control everything in our life. Okay. So basically,
I'm sorry, I cannot hear you. Something went wrong?
now I'm putting up a drawing. Nakita mo yung drawing ko?
Not yet. Yan. Okay, I can see it.
Okay. Ito yung balat. Ito yung cyst. Ito yung,
Yes. Okay.
yung cyst.
Yes.
Oh. Usually may mata yan eh. Di ba? May mata. Okay.
Yes, Doc.
So ang laman nito usually pasty substance. No? Pasty.
Mhm.
So as you talking about what's causing it, at the moment we don't know exact cause, but ang theory namin is that yung mga dead skin mo, no, pumasok, no?
Oh.
Mga dead skin. Kasi ang pasty nito, pag inoopera namin, ang kulay nito yung mga grayish parang libag kumisan, saka brownish, gano'n.
Yes.
Libag, di ba? Okay?
Yeah.
Pag nag-ipon-ipon diyan, magiging grayish, minsan magiging magiging dark blue, gano'n, no? Okay. So what you have to do is just to kasi hindi siya makalabas, no? Kaya nag-ipon-ipon siya, kaya lalaki siya, di ba? Okay.
Yes.
So what you can do as a conservative measure is just to try to press on this one na lang. Kasi sometimes I usually create the opening para bumuka, no? And then ask the patient to just press it out. Okay. So pag na-press out niya, lumabas niya, no? So liliit na yan, di ba? Okay.
Okay.
So pag lumiit na yan, you don't have to hurry up to remove it anymore kasi mahirap tanggalin, no? Okay. So you just keep on pressing it until lumabas, ma-evacuate mo yung lahat ng contents, no? Okay?
Okay.
So you can do that. That's an option, no? Ngayon, kung malaking-malaki na, you have to remove it. You have to do an operation. When you do the operation, we remove the entire balot. We have to remove the entire balot.
Okay.
If you don't do the operation, pag in-squeeze mo lang, there's a chance na uulit lang siya. Okay lang kasi hindi man, it's not cancer naman eh, di ba? You don't have to...
Pinag-antibiotic ako nung derma nung makita niya. And then she told me to go to a surgeon.
Mapula ba? Mapula?
Yung side hindi na.
Pero nung binigyan ka antibiotics, mapula?
Yes.
Okay. So kung may inflammation, redness, no? May inflammation, may infection, no? Okay.
Yes.
So you need antibiotics, but the best way to avoid the infection is to evacuate it. Try your best to if you don't like to have the operation, squeeze out mo lang muna.
I'll do it myself, Doc.
Yeah, kayang-kaya yan.
Natatakot ako.
Try it, just try lang. Basa mo lang, let's say 10 minutes, basa mo lang, no? I-soak mo lang. Pag lumambot na, tanggalin mo yung itim, yung mata. Try to squeeze it out.
Okay. Thank you. Very enlightening, Doc.
Okay. Any more questions? So those are the options. Basta i-explain lang sa iyo ng doktor, okay na yun, di ba? Okay, then make your decision, no? Okay. Hindi yung doctor sabi, ay, kailangan natin tanggalin na yan. Okay?
Binigyan naman niya ako ng options.
Kaya nga, sabi ko, may mga doctor na sasabihin sa iyo, tanggalin na natin yan. Kasi
Tapos, oh.
mas malaki yung kita niya kasi may operation. Di ba?
Pero alam mo, binigyan niya ako ng options, yun ang maganda. And then, nung pinatanong ko kung magkano kung gagawin yun, sabi niya mabilis lang yun kung siya ang gagawa, no? Operate. Nung tinanong namin dun sa mismong sa clinic, mga 3,000 plus. Sabi ko, mahal naman. Anyway, sige.
Okay, sige.
Thank you, Doc.
You're welcome. Oh. Any more questions?
I have a question. Doc, parang na-mention niyo po kanina parang circumcision is not necessary.
Yeah.
Bakit
Anong benefit ng circumcision?
yun nga, Doc, kaya ang tingin ko wala naman siyang benefit. Kaya lang, bakit na nakasanayan ng Filipino, pag na-reach na nila yung certain age, they have to undergo.
Okay, because of the culture, peer pressure, no? Peer pressure, di ba? Yung mga kantsaw-kantsaw. And then the doctors are promoting it. Okay. Hello?
Yes po, yes.
Okay. Kasi kumikita naman yung doktor pag nagse-circumcise din outside the operation tuli, di ba? Okay. So, may mga debate ako noon with the doctors, with the urologists. Tinatanggap naman ng mga doktor na hindi kailangan. Pero sabihin nila, kasi gusto ng pasyente, di kikita naman kami, di gawin na namin. Di ba? So those are the reasons kaya it's being promoted. Na. So anyway, I plan to give a talk on the next one will be on that, na circumcision. Okay. I won't explain too much now. Okay.
Okay po. Thank you, Doc.
Any more questions? We still have 6 minutes to go. Any question in the chat on the chat box? Abet?
There is nothing at the chat box, only a comment from Susan A. I was really enlightened, Doc. Thanks.
Okay.
And from Susan Tan, thanks very much for another informative session.
Okay. Ayan, si Chuchi. Chuchi, go ahead.
Chuchi, it's your
Wait. Okay, sorry, I had to unmute myself. Doc, I was just wondering, is the BRCA being taught in medical school? I mean, is there a subject in medical school wherein you take up this BRCA, or is it something that you developed yourself?
Okay. I can say I developed it myself because I didn't see it formally sa mga textbooks, di ba? Okay. And then, but over the years,
it's very good. I mean, why don't they teach this also to the would-be? Diba? Because that way you will be able to weigh very well kung if it's which is the best option.
So oftentimes what they're teaching is just the benefit risk lang, no? Benefit and risk comparison, no? So a lot of times they don't talk about cost then availability. The reason why I talk about the input, I think in-input ko yung availability because I have experience working the rural areas, no? Yung so frustrating that sabi mo, yung tinuturo sa amin gawin ito, wala namang kaming gamit dito. Anong gagawin namin? So susuko na lang ba? No? So sabi ko, I'll just look for the second option, di ba? Kung anong available, pwede pa, no? So that's why I factor in the availability, no? Okay. Now yung cost, nowadays, marami na pumapasok na they input the cost already. No? I'm happy to see some of the international guidelines, sinasama nila yung cost na. No? That's why I'm happy to see yung mga new development. But it's not formalized as a BRCA. Ako lang nag-formalize yan. Para it's easy to picture it, di ba? Yung table.
Yes,
BRCA.
yes.
Ganon. Thank you for your comments.
Thank you.
Doc, may I say something again? I hope you don't mind.
No, I don't. Sige, go ahead.
This is Susan, yes. with the implementation of the universal healthcare law,
Oo.
do we see something like this with what you're doing? Do patients like us see that the kind of pep talk you're doing to other institutions in other institutions?
Yung kung because of universal healthcare law, may makikita kang mga ganun ng pep talk ko.
Yes.
Mukhang wala ako na.
Ano ba yan? That is
Mukhang,
what we need. That is what we need because first of all, yung money kasi involved in healthcare eh. So we should have something like patient empowerment discussions or forum
yeah.
in all sectors, especially the poor.
Yeah. Now, I'm sure there are in various in various forms in various format, but not the same as mine. No.
Okay.
Okay. Saka yung as I said, yung universal healthcare law because parang essentially it's trying to give a lot of medical benefit to the people, no, especially the yung mga unfortunate yung mga what do you call that, underserved communities, ganon, no.
Yes.
But if the doctors do not change their practice, mauubos yung pera ng PhilHealth, no, mauubos pa rin. Kaya in other countries, because of the choose wisely, ganun din sila eh, no, nauubos yung mga pera eh, no, yung binibigay sa mga citizenry nila. So they're trying to educate the public and also the doctors also. So
Okay.
I hope they can pick it up yung choose wisely movement ng Philippines, no? Okay. But on our part, basta tayo just know about this, and then when you meet a doctor, just ask have your mindset on the low value, high value medical care, and then ask questions. Okay. So, pilitin nyo magtanong ng tanong. Ask and ask. No?
Okay. Thank you.
Okay. Any more?
I have a question, Doctor. Gaano ka-conservative ang isang management ng doctor wherein you can consider it as a conservative management, pero dumadating yung time na when you do blood tests or other things, medyo delikado na yung lagay ng patient. How deep is conservative management in your part should be conservative?
Basta there's an options of conservative management na pwede, hindi gagawin yon, no? And then, after you institute conservative management, dapat may follow-through, may surveillance, may follow-up, no? That's why I said, yung mga treatment that you do now is no 100% guarantee for success, whatever. So there's always there must be room for follow-up, check-up, no? So pag over time may nakita kang may undue development, may medyo kakasama na ng konti, no? Then pasok ka na iba na another decision making na yon, no? Okay. Parang in the previous mga lectures ko, di ba, yung sa abdomen, na I said in treatment, tatlong klase. One is talagang outright surgery. The other one is outright na walang operasyon. The other one is potential for surgery. Yung potential, yung pwedeng conservative muna, and then over time, pag may complication na, you can do your surgery. No? Huwag yung outright surgery. No? Okay. Okay.
Okay.
No more questions?
Let me see at the chat. There's nothing at the chat.
I suppose some of you will have personal experience also, no? Yung mga binabanggit ko, no? Okay. I don't think we have time to share them, no? But you went through that, no? So I hope tama yung mga sinasabi ko. Okay. 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 So if there are no more questions, no, we call it a day. It's 3:02. Pwede pa kung gusto niyo.
Anong talk pa, ano pa pong talk? Pwede naman mag-extend.
Anong tanong mo, Lina? Angelina?
Pwede naman po mag-extend kung meron pa kayong
No, something that's applicable, I mean, related to our topic. No?
okay.
You want to share your experience?
Ano lang po naman, Doc. Actually, nag-experience po ako ng, that was 1997, removal of uterus. Kasi sabi ng OB-GYN ko, hindi na ako ng second opinion. Mag-focus siya ng cancer. So, kaya nag-decide akong tanggalin siya.
Okay, okay. Ngayon.
Kung naman po.
Okay, would you like to share it? Okay lang? Would you like to share it here?
Sige po, Doc. Sige.
Sige. Di ba yung sa'yo, operahan ka na sana?
Opo, sa breast. Opo.
And then, anong ginawa natin?
So, nagkaroon po tayo ng another ultrasound procedure.
Okay.
Po, consulted ko po sa inyo.
Okay. So that's an example, di ba? So she was already scheduled for an operation, no? Because of the suspicion on VIRADS 4, no? Then she asked for a second opinion from me. So I said, paulit lang siya ng test kasi sabi ko yung test, kumisa hindi siya 100% perfect, no? So pinaulit namin. So VIRADS 3 ngayon. So ibig sabihin na reverse natin, di ba? Okay. So we avoided unnecessary operation as of now because I still have to check you up on next week, di ba? Okay, to finalize things, no? But that's already an example. In the past, marami rin akong gano'n, di ba? As I said, VIRADS 4, 5, no? Opera na sana, and then sabi ko, wag muna. Okay? So, then, na-reverse namin, di ba? I'm not saying 100%, but 99, 98, 99% na we avoided the operation. No? Okay. Okay. So that's an example. No? Dina. So, any more questions? So next time we will be talking about circumcision. Right after, nahirapan ako eh. I know there's a nice topic na how to interpret laboratory tests. Na, how to interpret. Okay. Ang dami kasi mga lab exams na ginagawa tapos they ask doctors, how do you interpret kung outside the border, gano'n, yung range, gano'n. So what do you do? No? So I've been working on that for the past 1 week, 2 weeks. I cannot, nahirapan akong come out with a concrete solution. Kasi yung sa binabasa ko rin, nahirapan din sila. Okay. Ang sinasabi naman nila, huwag na kayong gumawa ng mga test na hindi kailangan. Kasi the moment you do a lot of tests, you give the doctors a lot of problem. No? So, hindi rin nila alam kung anong gagawin. Basta sabihin na, ulitin na lang ulitin. Sige. Di ba? Pag ulit ng ulit, kung minsan, nagkakamali rin yung ulit. Di ba? Okay. Kahit na wala kang nararamdaman. No? Anyway, I'll try to come out with a compromise, how to come out with a better, practical advice. And how, okay. So next week will be circumcision, then thereafter, yung how to interpret laboratory. No? Test. Okay, so if there are no more questions, let's call it a day. No?
Thank you, Doc. Thank you.
Thank you, Doc.
Well, let's
Thank
have,
you, Doc.
Thank you, Doc. Thank you so much.
let's have another picture taking. Kanina ko lain po mga mukha ng mga tao. 1, 2, baka mawala na lahat. 1, 2, 3. Okay. Bye-bye.
Bye. Thank you, Doc.
Bye.
Happy weekend.
Okay.
God bless.